two-step etch and rinse, it has come up to simplify the bonding procedure. The primer adhesive single solution in two-step etch and rinse adhesive contains solvent and hydrophilic component from the primer that are mixed with the hydrophobic monomer from the bonding agent. So in the three-step, the primer and the bond was in a separate bottle, and in two-step they have mixed both of them together. Three-step etch and rinse adhesive result in better laboratory and clinical performance than two-step etch and rinse adhesive for the following reason. Two-step do not contain a hydrophobic bonding agent as the last bonding step. Hydrolytic degradation, which directly relate to the hydrophilicity of the adhesive, is more evident in two-step and rinse. Active rubbing application and the use of multiple coat of the adhesive has been shown to somewhat compensate for the lack of hydrophobic resin bonding agent layer as the last step in two-step etch and rinse adhesive. So again, I'm going to explain what I have mentioned in the previous and this slide, that lack of the hydrophobicity in the last layer has affected the bond strength. And they have found that because of the hydrophilicity exists in the top layer also, will increase its hydrolytic degradations. So to trying to overcome such a problem, they have advised to do rubbing applications and a multiple coating of the adhesive. This somehow will compensate for the lack of the hydrophobicity of resin bonding agent as the top last layer. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back again. Today we are going to continue the adhesive in dentistry. Last time we have stopped at the fifth generation, and now in a very short way I'm going to revise the most important point related to the fourth and the fifth generation. The fourth and the fifth generation are relying in incorporating a more deeper inside the dentine structure to enhance its bond strength. And has been approached by removing the smooth layer. The fourth generation is made in three steps by etching in a separate step, followed by applying the primer, which it is the hydrophilic portion of the system, and applying the bond, which is the hydrophobic portion of the system. In the fifth generation, they have incorporated the primer and the bond in one bottle, and they have vomit the third step. So, and the step was etching, followed by adding the bond, which it contained the primer. In the sixth generation, which is two-step self-etching adhesive, they have added the etching to the primer, and the first step was adding the self-etched primer or acidic primer, followed by adding the bond, which it contained a hydrophobic non-solvent bond. The idea of the self-etch adhesive was to bring this smooth layer again to the picture and forming a continuum in substrate and incorporating the smooth layer into the resin tag. Here we can see the illustration, what is the histological or what is the microscopic change will occur by applying the sixth generation. Actually, they have kept the smooth layer in its place and they didn't remove it like how in the fourth and the fifth generation by applying the self-etch primer, and they didn't do a rinse. So the step is without rinsing, and that's why the smooth layer has kept on its place. Then after that, the bond has got applied on it, and by this way, the smooth layer prime and the bond with the dentine structure has formed the hybrid layer, We can see here the last figure at the left side of the slide, the down purple color representing the smear plug, and the incorporated primer is at the top of it with the dark purple color, then with the violet color, the dentine adhesive or the bonding agent, and the hydrophobic bonding agent, and the top of it is the composite. So by this way, they have made use of this mean layer, and the bonding agent was able to bond with the organic as well as the inorganic also. In this generation, as we have mentioned, they have eliminated the acid etching step by one of the following way. Either the acid etch, which it is already exists in the primer, will be applied on the tooth, on the dentine, and after that, the bond will be applied to the dentine, or the adhesive primer, sorry, the etched primer or the acidic primer and the bond will mix together before applying it to the tooth. Let me again repeat this thing. We have vomited the etching step by adding the etching to the primer and applying it to the tooth structure. Then after that, applying the bond at the top of it. Or mixing the primer which contains the etch with the bond which it contain a hydrophobic resin, mixing it out of the tooth, then after that applying it to the tooth. Before explaining this slide, I want to go a step back for a point which I have missed to explain it. In the fourth and the fifth generation after etching the dentine, it is very critical the situation how we should keep the dentine before applying the bonding agent. Since the bonding agent in the fourth and the fifth generation, it does contain a hydrophilic portion, so the dentine should not be completely dehydrated. Otherwise, the hydrophilic won't be able to incorporate inside the dentine structure. At the same time, we should not keep the dentine wet. It should be moisture. It should not be dehydrated, and in the other way, it should not be moisture. Sorry, it should not be wet. It should be moisture. So, in the sixth generation, this critical point being avoided. Why? Because we are going to apply the etching with a primer and we are not going to rinse the etch. So the hydration and the dehydration is not going to affect the step of bond. Let us read together. The acid primer are not rinsed off and there is no need for drying steps. Biggest advantage of the sixth generation is that their efficiency appears to be less dependent on hydration state of the dentine than the total etch system. And we mean here by the total etch system in the fifth generation and also the fourth. The water is important component in the sixth generation. Why? Because without water that trigger demineralizations of the dentine substrate will not occur. And if the demineralization will not occur, that continuum substrate will not be able to get formed. So the self-etch, it is not susceptible to the variation of the moisture of dentine, but actually speaking, it does get affected by the chemical instability of the hydrolytic degradations of the bonding agent. The self-etch adhesive are less technique sensitive than are the etch and rinse adhesive. That means the sixth generation is less technique sensitive than the fourth and the fifth generation. As I have mentioned earlier, that the dentine status to be a moisture, not wet, and not dehydrate as well, it's an important step to have a successful bond with the fourth and the fifth generation. While in the self-etching, it is less sensitive for such thing. Also, the self-etch adhesive are less likely to result in a discrepancy between the depth of demineralization and the depth of the resin infiltration because self-etch adhesive demineralize and infiltrate the dentine simultaneously. In the fourth and the fifth generation, we do the etching in a separate step, and the depth of the mineralization will be created by the etching. It won't be equal to the depth where the bonding agent will incorporate or where the primer will incorporate. So there will be a discrepancy between the demineralized area created by the etching and the bonding agent will be filled in this space. But here in the self-etch adhesive, since the etching and the primer is being applied at the same step, it is of course will be filled it will be filled equally because both of them is incorporating and applied to the dentine at the same step since they are presenting in one bottle. In the self-etch adhesive, the 10-MDP is the bonding agent, which has been shown to bond chemically to the calcium in hydroxyapatite. If you remember, in the third generation, before they start to think to remove the smooth layer in the fourth and the fifth, they have used the 10-MDP, and we have mentioned it in the third generation. And the idea was that the 10-MDP has the ability to bind chemically with the smooth layer and the dentine substrate. In the fourth and the fifth generation, the idea of chemical bonding was not there. The idea was to create a resin tag inside the dentine in a deeper portion of dentine. But since they bring again the smear layer to the picture of adhesive, they thought to bring again back the 10-MDP. And we will come to know how much the 10-MDP is considered to be one of the most important bonding agent has come up to the field of adhesive dentistry. Here in this illustration, we can simplify the thing which I have explained right now, that if the etching is done in a separate step, the bond won't be able to fulfill the space created by the etching. While if the etching is applied with a primer, all of them together, the primer and the bond will be able to fulfill the same space created by the etching. Does this have any effect, any clinical relevant? Yes, of course, because if the discrepancy is there, there will be a risk of voids and also there will be a risk of post-operative sensitivity and micro and nano leakage. But if the space is not there, there will be no nano leakage and there will be no post-operative sensitivity. But of course, since there is nothing is complete unless the God, the self-etch, it does have a problem. It is a weak acid, so it won't be able to etch the enamel. The pH of the self-etch is 1.9 to 2, but how we can overcome this problem by dealing with the enamel in a separate way. So we are not going to account on the self-etching in etching the enamel, and we are going to etch the enamel in separate steps, in a separate step by the phosphoric acid, which it is 37%. So, and this is called a selective enamel etching, which it will improve the marginal adaptation and the marginal discoloration compared to the self-etch strategy. Of course, and this problem will occur particularly in, if the enamel, if it is not prepared and not instrumented. So again, the self-etch does not etch the enamel sufficiently, particularly if it is not instrumented. And how to overcome, to follow the selective enamel etching strategy when we deal with the enamel. After that, we can go for a self-etching with the dentine. But if we do etching to the dentine while using the sixth generation, the etched area or the demineralized zone will be too deep that the primer won't be able to penetrate it. One step self adhesive. Again, they try to simplify the thing of the sixth generation to do it in one step. Always, sometimes we in the industry to simplify the work, it may come over the efficiency of the work sometimes. And this what happened here in one step self-etch adhesive. And if you remember also the fifth generation, when they simplified the fourth generation and they have tried to vomit one of the three step to do it in two step, we found that the fourth is more better than the fifth. In the seventh generation, the formed bonding layer, it formed a semi permeable membrane, and this will facilitate the hydrolytic degradations of the resin dentine interface. Actually speaking, to be able to adhesive the enamel by the seventh generation, they try to increase the acidity of this agent, of this bond. And in such way, this has increased the hydrophilicity. Whenever the acidity will increase, the hydrophilicity will increase. And if the hydrophilicity also will increase, okay, this will make the degradations is more, the water degradations is more. Again, I'm going to repeat it. The seventh generation is set up to be in one step, so it can be applied to the enamel and the dentine together. And this to be approached, they have forced to increase the acidity of the bonding agent. Increasing the acidity, that means they have increased the hydrophilicity of the bond, because once the acidity is increased, the hydrophilicity will increase. So once we are applying it, this will make the bonding agent more absorbing for the water inside the dentine, and this will cause a water degradation. A simplified self-etch adhesive do not provide a hermetic seal for vital deep dentine. The pH of one step's SEA affect their clinical properties, and they try to overcome this problem by application of multiple coats of the bond. And they found that this can increase the dentine bond strength and decrease the leakage, suggesting that some of the one-step ECA may not coat the dentine surface uniformly. So the self-etch adhesive has a poor performance clinically, and this is because of the shallow resin tags, inefficient curing caused by the acidic nature, the solvent retention, like the water and ethanol, and also since the component has the hydrophilic and the hydrophobic in one bottle, this will create a phase of separation phenomena. Now coming to the most important bond has come up to the adhesive dentistry, which it is called universal adhesive. And in other terms, it is called self-etch, etch and rinse, or selective enamel etch adhesive. Since all the etching strategy can be made with this bonding agent, multi-strategy adhesion need new generation of one bottle dental adhesive. Since it is in one bottle dental adhesive, what is the difference between it and the seventh generation, which it is also one bottle, that the universal adhesive does have the 10 MDP, which the seventh generation doesn't have. Excuse me, it doesn't have. And that 10 MDP is capable of bonding ionically with the hydroxyapatite through the nano layering level. 10 MDP, one of the most important components, has got incorporated in the adhesive industry. The chemical bonding formed by the 10 MDP is more stable in water than any other monomer. The active application is by rubbing action, so this will enhance the chemical bond than the passive application. More chemical interaction to dentine than enamel. Self-etch strategy showed less nano leakage. Stable MDP calcium salt formed during reaction and deposited in a nano layer enable the universal bond to be used in any etch strategy. One of the best advantage of the 10 MDP that it will give me a flexibility in the etching strategy. For example, it can allow for me to do a follow the selective etching. So I can etch the enamel with the phosphoric acid and apply the bond and do a etching for the dentine with the same bonding agent without pre-applying of the phosphoric acid. And also, I can use the total etching for the enamel and dentine together by the conventional phosphoric acid of 37%, particularly if the dentine is sclerotic and it does need to be etched efficiently. And also, I can use the same 10 MDP in the universal bond in an area where I don't want to apply phosphoric acid, neither for the enamel and neither for the dentine, particularly in a patient who cannot stand for a long time, like the gender patients whom they are old in age and cannot bear a long stand procedure. Here in this illustration, we are going to see the differences between the dentine when it is kept moist after etching or the dentine after it get completely dry. As we know that the dentine it contains a collagen fiber and which it contains also a fluids. If I'm going to dry it, the dentine will be collapsed and the fluid inside it will be recessed also, and the collagen, the entire tubule will not be filled by the water, will not be filled by the fluid inside it. So the primer when it will be applied to it, it will not find a way since the fluid is not there anymore. While if the dentine is kept moist, the collagen fiber will be stretched and also the water will does exist. And when the primer will be applied to it, it will find a way inside the dentine. This is the most important simplifying photo to show us what is the difference between a wet area and a moisture area. We can see here the sea and the sand. The sea, of course, it is the wet area. The sand is the dry area. And the area close to the sea, the dark sand, this is the moisture. And this is the differences between the moisture and dry and the moisture and wet. The idea of leaving a moist dentine by applying or by using the universal bond and using the etch and rinse strategy, it is not important. Why? Because the universal bond in itself, it does have a water which can reach to 20%. So the water will re-wet the dentine. So if the dentine is moist, again the water will be added from the content of the universal bond to the water which it is exists because since the dentine still is moist and will reweight the dentine again, and of course, this will affect negatively. Leaving the dentine moist prior to applying a universal adhesive, the amount of residual work left in the dentine substrate will reduce the bond strength and substantially increase the hydrolytic degradation of the bonded interface. Rule of water in self-adhesive. Water is 10 to 30 by weight is added to the hydrophilic formulation to ionize the acetic methacrylate monomer and usually phosphate or carboxylic and to solubilize the calcium and phosphate ion that form the interaction between the monomer and with the dentine and the enamel. So the water, it is an important component for the solubilization of the calcium and the phosphate and for the chemical reactions between these substrate and the monomer. So that's why the water does play an important role in the self-etch adhesive. But on the other hand, increasing the water concentration will cause a dilution of the concentration of the acidic monomer and thereby lowering the bonding efficiency of the respective adhesive system. Biocompatibility. Dentine adhesive systems are well tolerated by the pulp dentine complex in the absence of bacterial infection. To prevent the bacterial infection restoration, it must have a hermetic seal. Adverse pulp reaction after restorative procedure caused by the combination of the following: bacterial of existing lesion or post of faulty restoration, pressure gradient caused by excessive desiccation, and this can be done by after drying in etch and rinse technique. Pulpal temperature raised during the polymerization of composite, especially in the flowable composite. Stress derives from the polymerization contraction of the composite and adhesive and polymerized resin monomer. By this point, we have reached to the end of the topic of adhesive in dentistry. I guess we have covered the most important portion in it, and I wish that you can read the most updated trend in the adhesive dentistry. It's called immediate dentine sealing, and if we are going to meet face to face, I'm going to explain it thoroughly for you. I guess we need a quiz to evaluate your knowledge after completing this chapter because it is very important chapter for me and for you also. So just let me think, how can I drop the quiz to you to assure a reliable result? Wish you best of luck. We will meet again in the following. I guess we need another 4 topic in the first sem of operating history in the fifth year. So wish you best of luck. We'll meet again in other topic. Take care.